And you're watching BBC Breakfast. Expect more UK cases. That is the warning from the government as it sets out further plans to tackle coronavirus, which has now infected more than 80,000 people worldwide.
So how might the outbreak affect you? We've gathered together a team of people who will be able to answer some of those questions.
Dr. Rosemary Leonard is a GP. Stephen Griffin is a virologist at Leeds University. And we've got Martyn James as well, who is a consumer rights expert.
So we're going to pick up on some of the questions. This one, Stephen, I think everyone's welcome to chip in. I should say that. Stephen, I think this is guided more towards you. And a question lots of people are asking. This is a question from Andrew. And how long can the virus survive on an object? We've all been in public places and we're thinking the same thing.
No, of course.
So we're going to see the question first. Let's hear from Stephen. Andrew.
Good morning. If I could simplify the World Health Organization and Public Health England advice, it's catch it, bin it and wash your hands. Now, if the virus can be transmitted by poor personal hygiene, may I know for how long it would remain viable on a worktop, a doorknob, a handrail or a similar surface?
Stephen.
OK, well, it's not a simple question because obviously there's different surfaces and different environments in which the virus is going to come into contact with it. By and large, these are very fragile viruses and they're easily disinfected with things like alcohols and bleach and what have you. There are studies on related viruses. It's not been done with this virus, I should emphasise. But for things like SARS, it can last between several hours up to a number of days. But that's very much depending on the surface that it's on and the temperature and the humidity. So something like a metal surface that was very damp, that was cold, you might expect it to last a little while longer.
Can I ask you, it's very hard to do specifics. I know. I've got a mug here, for example.
Yeah.
I've been drinking my mug and I've been holding it. You know, I've been holding it like this. I put it down.
Yep.
How long, if I had coronavirus, how long? Is there any idea about that?
Well, the main point is that it's very much proportionate to the amount of virus that goes onto it in the first place. So a lot of the laboratory studies are done with quite large amounts of virus. And as you take that down, its longevity gets quite severely shortened. I think the issue is, though, that all of these issues can be dealt with by good hand hygiene. And
it depends how clean Charlie's hands were in the first place.
Well, that would be ideal. That would be ideal. But, I mean, for example, there are cases with the SARS outbreak 20 years ago where they showed that getting it under control in hospitals, for example, was mainly done by good hand hygiene.
Yeah.
All the other measures were secondary to that.
Rosemary, that's a good point for you to come in, I think, because we have in the toilets here at the BBC now an 11-point hand-washing guideline, you know, printed out on the wall.
Yeah, it's the most important thing you can do in terms of stopping the transmission of this virus. And we were chatting earlier, and the previous SARS outbreak was stopped by good hand-washing.
So, Rosemary, are you going to teach Charlie how to wash his hands then? I think so.
So you're coughing, which is immediately we're thinking, now,
sanitizer
hold on a second, so you've just coughed, right? So the
I
correct procedure is what? You should now, use one of these? OK, here we are. We're actually seeing it in practice.
That's the sanitizer. So what you need to do, hands in the water.
Let me put that there for you.
Oh, I'm doing it.
Yes,
OK,
I've just coughed. So you should do it.
Right, OK, hands in the water. I've also got rings on, which aren't great, actually.
Yeah.
You know. So now this has to take. This is not a quick slap under the tap. You know when you just put your hands on.
Yeah.
This is a 20-second routine, and there should be a nail brush here as well.
Do you know some people?
Nail brush.
Some people will be thinking, it's you know, why are we teaching people how to wash your hands? But
in between my hands,
detail,
on the back of my hands, like that, and ideally I go at my arms as well.
Stephen?
Definitely, it's important to get sort of between the fingers, under your nails by doing it like this. We do the same thing in the laboratory, so you very much
like
tackling all the surfaces on your hands, not just a standard rub together.
And what doesn't work is a quick, which you see everyone doing when in public sort of basins, is just quickly under the tap. Then rinse them. Ideally dry them with a blow dryer, but can use towels.
Here we go. I heard this
and
week...
I don't think that probably wasn't 20 seconds.
Someone said you sing happy birthday, don't you, several times over in order to time yourself. But I've heard also this week that men aren't so good at washing their hands, that this is a message we particularly need to get out to the male audience.
Yes, yeah. I mean, washing hands and also keeping your hands away from your mouth.
Yes.
Yeah.
So in of face masks, for example, they are actually, when I'd coughed, a face mask would have helped, if it had been newly on, would have helped stop some of the viral spread. But once they're damp, they hardly stop anything.
So let's get on with...
But what they do is they stop your hands touching your face.
Yeah.
Yes. So let's have another question. This one, I think, for Martyn, sent in by Sheila. Can we have a look at that now? We'll just set that up. So this question...
We've had so many like this, in fact, about people's travel plans and what to do, whether they're going to Italy or further afield. Let's hear Sheila.
In a week's time, we're booked to travel to Venice by train via Geneva and then flying back. We believe that most places of interest are closed and possibly some restaurants too. Added to this, we wouldn't want to put family and friends at risk when we return. Very little has been said about Venice, other than the carnival being cancelled. So what advice would you give to two ladies of a certain age?
Two ladies of a certain age, or anyone, indeed. Although there are people who are more vulnerable to this virus, we certainly know that, and perhaps advice should be different for certain communities. But if the Foreign Office is saying it's fine to travel to Italy, do they have any rights? Does Sheila have any comeback?
Probably not when it comes to insurance, but this, let me tell you, I've had so many questions about this, including from as soon as I walked into the office yesterday, members of staff were instantly asking about their holidays. It's the #1 concern. There really seems to be a lot of worry about insurance policies and where your rights kick in. Now, in very basic terms, as a general rule, unless the Foreign and Commonwealth Office say on their website that they are advising against all travel to an area, most insurance policies won't pay out. I have heard some isolated examples of people who've been told that they will, so I would encourage people to in a claim anyway if they think they're going to be affected. As soon as that announcement does go out, then in effect you should be able to claim. Your airline probably won't be able to fly, so you'll get some cash back potentially from various sources. But this is the big issue. Insurance doesn't generally cover you if you decide not to go, even if you've got a very, very good reason for doing so. But if you get crafty, there are potentially things that you can do. If you're concerned about your own personal health, for example, your travel insurance policy will have a whole set of rules about cancellation. So speak to your doctor, and if they feel that it's a worry for you to travel, and obviously I'm sorry for clogging up surgeries, I know how busy you are.
We've done it already. Yeah, we've done it already. No, don't.
But it's really, really important to just get an expert on your side.
Let's be absolutely clear here. No one's saying that you cheat the system, but if you, for example, genuinely had some sort of respiratory condition or a vulnerability in some way, if you were pregnant, then that really could legitimately be a health reason that you could claim on insurance.
Yeah, and the other thing is if I see someone as being incredibly anxious about travelling, you can put a medical reason on anxiety. They're not going to be, it's not a matter of enjoying the holiday, but they actually, if you're going to cause a mental health condition by travelling to somewhere, then I think you have a reasonable, you can put it down.
I'm trying to go through quite a few of your questions this morning. So we've got one, Dr. Rosemary, for you. This is Patricia.
When people have had the coronavirus, can they catch it again or do they become immune?
So this is an interesting one, particularly this morning we heard news that a woman in Japan had apparently tested positive again. Generally with viral illnesses, and it applies with coronavirus as well, when you are infected with the virus, you get an immune response, you develop antibodies, and you can't get it again, which is the whole basis of why we develop vaccines and why we're now trying to develop a vaccine. The thing about, and I would say, in general, once you've had it, as long as your immune system is working properly and you've developed a good immune response, you should not get it again. This woman in Japan, who apparently has had it twice, we don't know whether, in fact, how she was tested to know that she cleared it. Normally, you test you have 2 clear viral tests a good 2 weeks apart, and she may not have had that.
So, Stephen, just go back one step from that position.
Sure.
Some people say, I never get a cold, I never get ill, all those things. Is any of that relevant to coronavirus and who may or may not test positive?
Well, people do better when they're unwell, the healthier they are and the younger they are, and so you'd be less likely to get unwell that way. But having other illnesses has no relation to this virus in particular whatsoever. So that sort of anecdotal story isn't really helpful. It's important, for example, at this time of year, because we have seasonal flu, that people are vigilant about having their flu vaccinations if they're eligible for them, because you don't want to either put yourself in a weakened state or to confuse your symptoms between flu and coronavirus, ideally.
Can I also add in then, the GPs have still got lots and lots of flu vaccines, so if you're in an at-risk group and you haven't had the vaccine, and there are lots of people out there who haven't, because the uptake on the vaccine's been low, go and get your flu jab now.
But that won't make any difference in protecting you from coronavirus.
It won't protect against coronavirus, but if your immune system is fighting one virus, you're more vulnerable. Also, if you've had the flu vaccine and you get flu-like symptoms, we will know far more that it's likely to be coronavirus.
Can I ask this one to you, Steve? Celia Hallisey has emailed to say, how does the flu virus naturally die out each year, and will this virus behave in the same way? Will it run its course and go away?
Sure, so there's a seasonality to flu. It comes across the planet from the east, and it tends to go away in the summer months. That's slightly less true since the swine flu outbreak. There's much more circulation going on. But there is certainly... The temperature is a factor in the survival of these viruses in the environment, so there is a seasonality there. And there's every reason to believe that this may also apply to the coronavirus. There's thinking along the lines that if we can get on top of various outbreaks before summer, then that will help us in suppressing the number of cases.
Question from Nigel Enriquez. I guess you share this between you. Martyn, you might want to pick up on it. What are the airlines doing about the actual planes, the insides? Do they disinfect them in between flights as a precaution? Are they doing anything different? Do we know about that?
That's a very, very good question indeed. Well, as anyone who's got a budget flight recently will know, those flights are turned around very, very quickly.
They barely clear the empty crisp packets before the next people are on.
And you can find a few little surprises left around in the pockets and everything else. So whilst I wouldn't want to cast aspersions against the airlines, but certainly they will be taking additional precautions. But, you know, we were chatting before, really, really interesting chatting in the morning with virologists and doctors. You learn a lot. I've learned an awful lot today. But I've spoken to a couple of people who are singers, or you had Callum on before as an athlete. There are certain precautions that people take, like not sitting near the seats that are near the toilets, because that's where people tend to loiter, and also wiping down the tray in front of you is another way that people do to avoid catching things.
Just a quick pick-up on that one. I'm really done for time, but on that thought, I mean...
Well, again, your environment is your environment. You can deal with that primarily by dealing with your hand washing and sanitising your hands all the time. Obviously, again, the best way of dealing with this, again, is social distancing. So keeping distances, not shaking hands.
You and I are too close.
We're a little bit too close, but that's OK. Just
Rosemary and I?
Yeah, and the other thing is, when we all walked into the BBC this morning, the charming people at the desk were all shaking our hands. Yeah. That probably, and I know it's very British and very polite, we probably ought to stop. We agree, we ought to stop shaking hands.
All very good, useful information. Thank you very much. Well done with the hand washing. Even though you're about 10 seconds short or something. But good.
Well, I'm going to get so criticised on social media.
You should follow soap with your alcohol as well. That was
there we go. Thank you very much. Time now is 8:27.